Considering that colon cancer is the third most frequent malignancy in both men and women can be frightening. Unfortunately, symptoms don't appear until the condition has progressed further. Despite this, many people will exhibit early illness indicators, many of which are easily missed. It is best to detect and treat colon cancer early, as with all malignancies. So here in this video, we will discuss early warning signs of colon cancer you should not ignore. Number 8. Unexplained weight loss. A sudden and unexplained loss of weight can be a symptom of many other disorders, not just colon cancer. If you lose more than 10 pounds in a span of a few months without making any changes to your diet, you should be checked out. Unexplained weight loss could be caused by several different things, including colon cancer. Cancer patients may occasionally experience a loss of appetite as a side effect of their disease. Sometimes cancer can advance to the point where it will fully or partially clog the bowel. This can happen either completely or partially. In any case, you run the risk of suffering from a loss of both muscle mass and famine if you place yourself in either of these precarious situations. Number 7. Fatigue and weakness. Fatigue and exhaustion are not always easy to distinguish from one another. On the other hand, they are not the same thing. Sleep and rest are usually effective in overcoming feelings of fatigue. On the other hand, fatigue caused by cancer is distinct and is typically characterized by feelings that are similar to those of being tired, weak, worn out, heavy, slow, or lacking energy, or get up and go. You must make an appointment with your primary care physician if you feel that you could be experiencing exhaustion. Number 6. Constipation. One of the most frequent gastrointestinal symptoms, constipation is described as having less than 3 bowel movements in a week and occurs when a person does not have regular bowel movements. But having constipation does not necessarily indicate that you have colon cancer. Altering your food, developing poor dietary habits, experiencing stress, becoming dehydrated, or not getting enough physical activity are all potential causes of constipation. If you have constipation that has lasted for more than 2 weeks, it is recommended that you visit a doctor so that the root cause of the condition can be identified and treated. If you're enjoying the video so far, please like and subscribe, and also leave a comment about which type of video we should do next. Number 5. Abdominal cramps. It is possible that patients who have colon cancer would not develop abdominal pain, cramping, until the later stages of the disease. This is because the location of the tumor and other factors have a role in this phenomenon. On the other hand, abdominal pain can be an early indicator of colon cancer for certain people. Bear in mind that pain in the abdomen region can be caused by a variety of other illnesses, including those that are not malignant, such as hemorrhoids and irritable bowel syndrome. But you should make an appointment with your primary care physician if you have been having stomach pain that has only recently begun, is severe, and cannot be attributed to any other ailment. Number 4. Changes in bowel habits. Alterations in bowel habits, such as transitory constipation, diarrhea, or diarrhea with small stools, can be considered normal if they are just brief. But if symptoms persist after a few days, you should talk to your doctor about them right away, because they are one of the earliest warning signs of colon cancer. Remember, these shifts can be attributable to other disorders that aren't as problematic, including irritable bowel syndrome. If you notice a change in your bowel habits that does not resolve itself within a reasonable amount of time, you should make an appointment with a medical professional. Number 3. Blood in the stool. Blood in the stool is a warning sign that can be associated with colon cancer. Under certain circumstances, this blood may be a vivid shade of red and quite easy to spot. It is possible that you will not notice it until you have bowel motions, or it may appear on its own. In some instances, the blood that is produced by colon cancer might cause the stool to become darker. It is also possible for bleeding to be so minimal that it is completely invisible. Even while the presence of blood in your stool could be due to a wide variety of ailments, such as hemorrhoids or something else entirely, you should never avoid going to the doctor about it, especially if it happens more than once. Number 2. Diarrhea. It is not uncommon for patients to experience diarrhea and loose stools. The disease may have been brought on by an intolerance to particular foods, an adverse reaction to a drug, excessive stress, or direct contact with microorganisms, often experienced when traveling. The vast majority of people will suffer from diarrhea at least once or twice per year, usually in a milder form. In the vast majority of cases, the issue will heal on its somewhere between the second and third day. Diarrhea that has lasted for more than 3 days should be investigated by your healthcare physician. On the other hand, the symptoms of colon cancer can include prolonged diarrhea in addition to other problems, such as bleeding. Number 1. Feeling full all the time. Feeling full all the time can be an early warning sign of colon cancer that should not be ignored. Colon cancer occurs when abnormal cells grow and multiply in the lining of the colon, leading to the development of tumors. As the tumors grow, they can block the passage of food through the colon, causing feelings of fullness and discomfort. Hope you guys enjoyed our video. Make sure to subscribe to our channel and hit the bell icon for more videos. If you need more exciting and informative content, then check out more of our videos. Thanks for watching and have a wonderful day.